So first of all, I want to welcome you all to this meeting. This is a faith leader check-in that we like to have every so often, just to connect with our faith leaders and continue that partnership with our faith leaders. We have the opportunity to have folks from Urban Strategies here to talk about their expertise and talk about vaccines and working with faith communities. So I'm here to welcome Kike Martinez and Juan Salgado here to this space so that they can share their expertise. Awesome.
Hi, everyone. Thank you for having me here. My name is Juan Salgado. I'm a Senior Regional Director for Urban Strategy in the Sunshine State of Florida. And also I'm an engagement specialist for AIM and the CDC, working with my friend Jen Merlise, working since the pandemic started with the faith community, promoting the vaccine, promoting the testing, and the flu shots too in the community. Thank you.
Hi, everyone. Nice and it's so great to be here. Thank you, Jen Marilyn, for this opportunity and Low Community Center as well. My name is Kike Martinez. I'm from El Salvador, Central America, and I'm working with some partners in Latin America and in the United States. And especially with Jen Marilyn and Ronnie, we've been in this journey for a long time about COVID. Well, we started with flu vaccines and now COVID, and it's been beautiful to see how they have engaged with the community and all the ideas and meetings like this, how came up from these great efforts. So we're here to serve you, and we're excited to have a great conversation today about the churches, faith-based organizations, and the COVID.
Awesome. I think this is a great opportunity to just go around and introduce ourselves, and then hopefully some more people will trickle in and contribute to the conversation. So like I said, I'm Jean Ridley. I'm from the Health Center, working closely with REACH to work on COVID and flu education, vaccination, and prevention. And I'm gonna pass it over to Ruth, if you don't mind.
Hi, everyone. My name is Ruth Ogembo. I'm the Program Director for Community Health Programs at the Lowell Community Health Center. And my faith leader hat, I'm also an elder at Lowell All Nations SDA Church here in Lowell. So I'm here until my pastor shows up. I will be wearing 2 hats in this meeting. So yeah, thank you.
Thank you, Ruth. Romilda, do you mind introducing yourself?
Hi, hello. My name is Romilda. I am from Low Community Health Center. I work with Jimali and Ruth, and I'm a member of a church, but my pastor didn't show up yet. I'm hoping that he comes, but it's great to be here. Great opportunity.
Awesome. Thank you, Romilda. It's great to have you here. Ronnie, go ahead and introduce yourself.
Thank you, Jean-Marie. Hi, my name is Ronnie. I'm a community health worker at Lowell Community Health Center. I work with different programs with Jean-Marie, Romelda, Ruth, also with COVID and flu, and also I do work with Asthma Project. In addition, I have to do TV show weekly for the my community in Lowell.
Awesome. And Imogene, do you mind going?
Yes, as Jean Marie said, my name is Imogene. I am Protestant campus minister at UMass Lowell, and I also happen to be the music director organist for a church in Harvard Square, University Lutheran Church.
It's great to have you here.
Thank you.
Reverend Kimata, do you mind introducing yourself?
You're muted? No, there.
Yeah, I am.
Hi, do you mind introducing yourself, who you are, and where you come from?
Wait a minute.
It's nice.
Yeah, my name is Reverend Joseph Kimatu. I'm a pastor with the Ushindi Presbyterian Church in Lowell, Chelmsford, Lowell.
Awesome. It's great to see you here.
Thank you.
What was the name of the church?
Ushindi Presbyterian Church. Ushindi means victory. It's Kiswahili for victory.
Wow, amazing.
Yeah.
So I am just gonna facilitate some questions with our folks with Urban Strategies. And we're gonna just start off and get it rolling, right? So I think, you know, I'd love to hear more about your work with faith communities and responding to the COVID-19 pandemic during the past year. Would you mind sharing?
It's confusing, very confusing, because we are getting like mixed messages about the vaccine. Sometimes it's working, it's for a long time, other times it's 6 months, other times it's 8 months. It's approved, it's not approved, authorized for immediate use. Some people are getting sick, others are not getting. We are getting very mixed messages from the CDC, I think.
Yeah.
And that is why I think the media itself, the mass media, like YouTube and all that, are also giving us very strange messages, and people are like kind of taking them in. If they include all the other messages that are not that direct, it's kind of confusing for us. So when you start there in church and people start asking you, are you not wearing a mask? I am vaccinated, but the governor of Massachusetts said, no, we should not be wearing masks because there is a new variant. All of this, it's a lot for our congregants to digest. So we are kind of out there now once again. We thought it was over, and all of a sudden, boom, and you are back dealing with it. So that's the dilemma that we have. Are we going to encourage people to wear masks again? Or are we going to tell them no masks? People have come back to church. Others have withdrawn because they feel the new variant is everywhere. And also those who are in and have not been wearing masks, should they wear, or should we take the booster? Should we not take the booster? I think the messages we are getting, the signals we are getting are not the best. It's like somebody turning left and then the signal turns right and then turns left again. You are not sure whether you're exiting right or left.
Right.
Yeah.
Thank you for sharing. To you all, Kike, Juan, do you have any thoughts about that?
Well, pastors, thank you for sharing that. You know, and probably more than give an answer to that, it's would like to share some of our experience in the field with Juan. And there's a lot of voices out there. There are a lot of voices, and our church members, they are, let's say, I just try to think in a day of one of our church members. They get up, they go to work, and at work they hear from their coworkers, right? They get one message there. Then when they go back to their houses, they hear from their families. And let's say most of those that have families in other countries, and in my case, I can speak of the Latinos, right? A lot of people from Mexico, Guatemala, El Salvador, Honduras. So when they go home, they talk to their relatives in those countries and they hear some information from there. Then they go to church at night or on a weekend and they hear from the church leader. When they are at home, they hear from the governor or the news. So it's a lot of information, Pastor Joseph. So I agree with you. It's a lot. So I think we all are in the same boat about this. What I can say is we cannot persuade people. We cannot tell them what to do, and we need to be wise. And some of the things that we talked with the priests and pastors that we walked, along with the communities, is like, how can we have these meaningful conversations with them and help them to navigate those doubts, right? I think something that is very important is okay, we need to take care about our health first as people. If we take care of ourselves, we take care of our community, of our family, of our relatives. And so advocating for not getting one certain type of vaccine or listen to one, news or family, it's more about help them to realize how important it is to be careful of our own health. Because remember, there's COVID out there, but soon will be the flu. And so we need to start to think about that as well. And how can we be in the boat with them in not telling them what to do, but discovering together, why it is important, why it is, what do you think if you don't wear a mask? What do you think can happen? And ask those questions. Because if we ask more questions, they will start realizing by themselves. And we can create those, we call them aha moments, when they will say, oh, yeah. So it's not just about they're making me wear a mask. It's because if I wear a mask, I will protect my people. And it takes time, right? It takes time, mostly with the people, with the church members and people at church, because we gotta be polite. We gotta have the goal in mind, which is having good relationships and everything. So that's has been my experience in the field. And I don't know, Juan, what do you think about what Pastor Joseph just shared?
Yes, and I think the most difficult thing is because some of the voices people are listening to are very loud. They are coming from people with big megaphones. And some of these own the largest churches. And those who are anti-mask and anti-vaccine are those pastors with the mega churches, especially in the southern states. And they have penetrated into our room, into our table rooms and bedrooms everywhere on TV. And a lot of people in their spare time listen to them. I was talking about one, I think it's Greg Lochi or something like that, who told his congregants on Sunday that if you come to church wearing a mask, he's from Knoxville, Tennessee. If you come to church wearing a mask in my church, I'll kick you out. And that thing is broadcast everywhere. And our congregants, most of them do not have the kind of, I would say what? They are not ignorant, but then sometimes they are not able to make informed choices. Who is telling the truth? Who is telling a lie? I think what you are lacking here is the voice of healthcare workers. Those other voices are very loud. So the healthcare workers are like diminished in their voicing it out. And I don't know how this can be brought up. And I think whatever they tell the people should be one message and not some mixed message. Because if we tell too much about the failure of the vaccines and then we need another one and not hinge on the effectiveness, then we are giving these other people who are anti-vaccine room to expand their negation of the whole thing. My thoughts.
Yeah, thanks, Pastor Joseph. We are like, it feels like we are walking against the big wave of anti-vaccine news, right? A lot of influence coming specifically from the South, as you said. But I would like to hear what other people think, or what have been others' experience in this with the COVID or vaccinations in your faith communities.
I think for speaking for my church, Aloha All Nations, when it was, when before the mask mandate got kind of removed, and when we went back to buildings, everybody was wearing the masks. There were some who would take random mask breaks and then forget to put them back on. But if you say like, hey, just put on your mask, people were very willing to do that. Now that people have been vaccinated, and then the CDC said that if you're vaccinated, you don't need a mask. And people stop wearing their masks. So we do have a good amount of population that has been vaccinated, and some who the high risk, those who have comorbidities, they keep their masks on, vaccination outside, indoors. Like we do have that group that continues to wear them. And then we do have a group that I got my vaccine, I don't need to wear the mask because the CDC said I don't need to wear a mask. And then you do have those who are not vaccinated, and I'm outdoors, the CDC said we don't need to wear masks. So I think there are those like the mixed, and where the challenge becomes, you can't go up to people and ask, are you vaccinated? Because you're not wearing a mask. So you just pray that for those who are not wearing masks, they have been vaccinated, but then some of them are younger. We do have a lot of children in the church who are not vaccinated because they don't qualify to be vaccinated, but they're not wearing their masks. But the CDC said you don't wear your masks. So that is now what people are hanging on to, that, but the CDC said we don't need to wear masks, so you can't make me wear a mask. But for those who, for their own health, who know that I have other health issues, they are sticking with their masks indoors, outdoors, they are sticking with their masks. And others, you will see the mask come and go. And then there are those who are just not wearing their masks at all. But there is also a conversation happening around the vaccine when we talk about the vaccine, and then, the conversation around, but we have God, so why we need the vaccine. And, now as the workplaces are mandating vaccines for their employees, there has been conversation that is being had on how do you write a religious exception letter for me so that you can qualify for that at your workplace, so you don't get, you don't lose your job. So definitely there is a education on both fronts, that if you believe you don't want to get a vaccine, this is how you write a qualifying religious exemption letter so that you don't lose your job. And yeah, so there is all of those camps in my congregation.
Excellent, Ruth. Thank you for sharing that. And I don't know. You mentioned something very important and interesting, is that the youth are not wearing masks. And I specifically, I have a problem with the youth because I see them all around the church or anywhere not wearing masks. And I just really want to tell them, hey, dude, wear your mask or something like that. And it's interesting. The other day we were talking with the church about how they were addressing, where they're addressing the mask with the church and the youth. And it was interesting that this church leader from Texas, he said, one of the things that we're doing is we are trying to talk about self-awareness, right? And all the things that we need to be aware, first of all, with ourselves. And now we have introduced the mask as one of those things of self-awareness. And that would, instead of pushing them to do something, it's part of their messages on service. It's part of their discipleship with the leadership that they're having. So that was important because it was nothing imposed, but they're using a different strategy and how to do it. Or they make announcement, okay, we're gonna let people coming into the sanctuary, like 15, you gotta register and you gotta wear your mask. And then you're not telling them individually, but if you wanna come to the sanctuary, or if you wanna be part of a activity, you gotta wear your mask. So, and probably one of the encouragements that we're, doing with the church leaders is listen to the CDC, because in some states, I can speak of the state based on the states of Illinois, because I live in Illinois. So in Illinois, every 2 days, the governor is making announcements. Okay, these are going to be the new COVID mandates or the new COVID restrictions. And what the church is doing there is they are broadcasting the information from the governor. so the members can know about that. And then the services are going to be regulated based on the new COVID restrictions for the state. Like in that, I'm saying in Illinois, now you got to wear masks indoors everywhere, but that's Illinois. I don't know other states. So that's very important. And, you know, I heard that through the church. The church, they sent us a newsletter. Remember, this Sunday, we all need to wear masks. This is part of the state, et cetera, et cetera. So yeah, Juan, I want to let you talk. I think I've talked a lot.
Yeah, talking a little bit about the religion exception, there's a big issue here, Kike, because there's many mega churches that, let's be honest, in big churches, pastors don't know everybody. Here in Orlando, there's a 12,000 member church. Do you believe the pastor will know each person? And in some places, even in Puerto Rico, some people are getting the sign letter of the pastor of the exception, and the pastor don't know him. And that's an issue for the pastor, legally issue for the pastor. It's important to, yeah.
I don't know. Sometimes I kind of lose a little hope because we make a step towards the right direction and then we make like 3-4 steps back. Because you talk like a caring, effective governor, like the governor of Illinois, and then you go to Florida, who is doing exactly the opposite thing. And those who are dying now are kids, they are children. Go to Texas, and they are very popular governors, very popular within one of the parties. I read an article before we came to the meeting from Georgia, and Georgia has stopped releasing the data for COVID infections. So you kind of sending messages to people, and these messages are very conflicting rather. And you wonder why those people who listen to those kind of messages, how are they going to survive? How are you going to convince them to do this? And most of those people who speak loudly are the ones who are anti. And they're actually even whatever you are getting from Fauci and all the others, sometimes you feel we have been lost somewhere. Yes, they are giving a nice message, but it's meeting a negativity which is outside there, which is too strong, that people do not want to listen. I am a fan of reading what people write. So I go to Instagram and Twitter and whatever. I read all those and Facebook. I just want to see what people are saying and how they are behaving and how they exchange news. And you see most of what is there, those who are very active are the ones who are not for. They're the ones who are not for. And some of the most popular media, TV stations, they're the same. So you start wondering, when shall we come to an end with this kind of reaction to something that we can control very easily? It's like some people somewhere want people to die deliberately by denying them ways of protecting themselves. Or they want to sell drugs to cure. So they don't want drugs to prevent. They are somewhere hidden making drugs to cure the disease. And for your drug to sell to cure, you must have sick people. So you tell people, do not protect yourself, come and I'll give you a drug. And it has started happening. So it's a very difficult fight. And yeah, we are people who trust in God, but then we have our responsibility. So if I can have someone advise me a little bit, I would be very happy. to go about it, just to give me a little hope.
I think I
Wow.
saw, sorry, my church, the pastor sent out this, so the worldwide Seventh-day Adventist Church, they sent out like a 5 to 6 page information on, so answering most of the common things that people would say that I don't want to get the vaccine because of this, and going into a little bit of detail about what scripture means by that scripture you're quoting. This is what that scripture means, this scripture you're quoting, but also bringing up other scripture about taking care of self and taking care of neighbor. So it's not telling you that you should or you should not, but here is the information from a biblical standpoint to help you make that decision. So that is something that has been sent out to all the churches in the Seventh-day Adventist, which I found very informative. The only challenge is that it's 5 to 6 pages, it's in English, and it's quite lengthy. So you have to be an educational kind of person to sit there and read all of those things. It hasn't been distilled that a common person with maybe low reading literacy level can actually pick it up and comprehend what is being talked about. So there is that challenge. I mean, it was a well-written document, but it's not going to get to my 15-year-old who needs to hear this information because it's too long. They don't read that many. It's too long, no pictures, just words. So the formatting could be better. But something like that, I think, for me, I found it a little bit useful as somebody who's both in the public health world, trying to encourage people to get their vaccine, wear their mask, and all of that from the health standpoint, but also having to balance the biblical aspect of, okay, you are putting this scripture at me to go and get, putting on a mask or getting a vaccine. But this helps kind of provide guidance for those in leadership to help answer these questions.
Yeah, I noticed that. I noticed that the information, the boot kit, it was too long. If I share those, first it's gonna be a lot of money because I share with thousands of people every month because I have a technique that I go to food banks to share the information about the vaccine. In that way, I can reach more people. So it's important if your organization, do you have a marketing, IT, or graphic design? In our case, Kike is our champion. Every time I want to share something, I try to do something like maybe with a graphic, like something that I can share. I asked the pastor to put that small graphic saying what I want to share. For example, if I want to share the special enrollment period, the city, the health, the government health expand the Obamacare. It's not the Obamacare. It's the Affordable Act extended to August 15 because the pandemic. I want to share that in the community. So instead sharing the big book about what is that, I only shared the name, what I believe was the important thing the community needs to know. And Kike and from the help me to do that. Also, I believe there is a big and this is my opinion. Remember, maybe Kike's opinion it's different. But my opinion, the disinformation is the big issue here. Let's be honest. This pandemic, it's new. We all have some insecurities. We all have some doubts, but we need to trust the CDC. They are reliable and they are human. They every day there come new information, but the vaccine it's saving people, and that's what they never lie to us. They never say we are not going to get the COVID with the vaccine. They didn't say that. They always say it's gonna be mild if we get the virus. But that's some, in my opinion, some people, and I work with the faith community, you know, and this is not about race or education. A couple of weeks ago, part of my job is promote the vaccine. And this guy in the early 40s, successful entrepreneurs, sent me a messenger by Facebook. And he, you know, he say, hey, Papa, hey, guy, you are promoting the mark of the beast. How can you do that? And this guy has education. He's in the early 40s. So it's not about race. It's not about, this is disinformation, I believe. And I need to, you know, if that his belief, I respect that. But honestly, in my opinion, working with a lot of churches, doing a lot of vaccine events, the majority of the people who get the vaccine, they feel more secure. If for some reason they get COVID, the symptoms are really, really mild. And that's my opinion. That's my experience. We need to be careful, because part of the disinformation is disinformation of the untrusted news. You can share, and if I share, nobody knows me. If I share a fake news, probably gonna affect a couple of thousand people. But if you're a pastor, if you are a politician, and you share something that you don't know it's true, you can affect a lot of people. And you know, we have to be careful what we share on social media. The other type of disinformation is untrusted. When I say untrusted people, I'm not saying they are bad people. even my mom once told me something about the vaccine, and my mom is not bad. She loves me, but she heard something that the neighbors say, that you know, it's a chain of people saying stuff, and she told me that, and it wasn't true. So we need to take care of two types of untrusted sources, people that you know, that you have to be careful. And I believe the CDC is the most trusted resource that we have. Yeah, they changed some of particular information because this is new. They're not coming from the futures knowing everything. But at least you know, the vaccine news are good. Now the Pfizer is completely approved by the FDA, and we need to try to. I'm not promoting that people get the vaccine. I'm promoting that people at least get well informed, know the benefits, and they take their own decision. That's me personally.
And I would agree with you in almost everything, but maybe the last sentence, because the last sentence you said you are not promoting people to get the vaccine. I think we should be promoting. Otherwise, if they don't get the vaccine, what is it for? If they don't get vaccinated, we're telling them to get sick or to make others get sick. If they are not vaccinated, they are exposing themselves to getting infected and then infecting their families. So I think in our promotion, not being insensitive to freedom of choice, but if you speed on the road, you get a ticket. How about if you kill somebody by driving your car carelessly? You still get punished. How about if you are spreading diseases? There are little things that people do, and there are restrictions here and there that don't give you full freedom. What I do, and we have done this with Jean Marie, when we go to the radio, tell the people you need to be vaccinated. It has more benefit than not. If you care about your family, you need to be vaccinated. If you care about yourself, because what you're waiting for is people who are very much anti-vaccine, and we kind of promote them in that situation. When they get sick on their deathbed, that's what, when they tell their families, get vaccinated. But we have lost them. And I think that's where we are losing the battle, because we are not standing firm on what we believe and what we are advocating. If you are advocating for something, you need to have a stance. You have to have a position. This is my position, and I believe in it. And this is the way to save lives, to take care of the others, get the vaccine. Whether it is making you sick or whatever, those are like little nuggets here and there. But the major thing is that if you get sick, you not be hospitalized. You are not a candidate for death, like those who are not vaccinated if they get the new variant. Because if we are literally laxed on one side, then this battle is going to be a long, drawn battle. You never see its end.
Yeah. And Pastor Joseph, you know, I know that right now we are in a faith environment, correct? And something that I heard the other day, I want to share with you, and I'm going to mention this. Someone mentioned Proverbs 22:3. Do you remember what Proverbs 22:3 says? It says, a prudent person foresees danger and takes precautions. The simpleton goes blindly on and suffers the consequences. And that's why we have seen a lot of churches that are using their discipleship process to talk about this. Because through discipleship, you can create that authentic relationship where I can tell you, let's say, Pastor Joseph, I'm with you in the discipleship, and hey, Pastor, I'm reading here in Proverbs that if we are prudent, you need to take precautions. And okay, let's translate that. Okay, you got to wear a mask, you got to get vaccinated. Okay, and if we're preaching about a Jesus who loves the neighbor, what means loving the neighbor? Okay, how can I love my neighbor and care for the neighbor, for the community? And I will say, it's not because we cannot go outside and say, that's why I'm feeling free to share this in this environment, because we are with faith leaders. But I cannot be with people from the government just telling, hey, Proverbs says this, blah, blah, blah. We're gonna politics and religion. We're gonna talk about that. But if we have an authentic relationship, a discipleship, we're gonna be able to connect and share a message. And in the time, people will start learning more.
Yes, I do agree with you by doing it piecemeal, like reaching out to our small groups and then widening the scope. But I also see COVID has extended the church outside the four walls, because now we are streaming. If you go to Shidi Presbyterian Church on Sunday, they're streaming our services. And 100 people are out there listening and following us. And that's what people do. Once we stopped going to the churches, people are looking for other avenues to do that. And they listen to preachers everywhere, and they follow the services. Some are recorded, others are live. So if we stick to our own congregations, yes, we shall make a difference within the congregation. And it is very difficult for it to transfer to the wider world. So this is what I'm thinking about is this. If we have an avenue, like I had radio this morning, and I was speaking to people in Arabia, people in England, people everywhere, US. And I was there for an hour. And sometimes I do invite Jean Marie. I think Ruth has had a chance to come and speak. If about, let's say, 10,000 people are listening, and they are not from my church, and the COVID is everywhere. There are people in the South who are listening, where their governors are telling them, don't wear masks. And if teachers tell people to wear masks, they're not going to be paid. I will withdraw my money from that school district. What message are you going to give to them? Because our avenues are now greater than what we think. Yes, we can do little things with our families, talk to our neighbors, talk to our church groups, but does that make an impact for a disease that is raging? The storm is raging. How do we kind of counter this in our fields of influence? That's the dilemma that I am in. Yes, because I do feel about people, and as I said, I do look at those platforms that people have created, and I belong to about 20, 30 walls with more than 100 people in each wall, sometimes 200 people in each wall. And people are exchanging these ideas. I see that if I am saying that people should get vaccinated and I post something there, it's like there is no leadership. If somebody comes and posts something and says, if we are vaccinated, we're going to die in the next 2 years, that is shared, and I find it in every other wall that I belong to. But what I have written there doesn't make an impact. So we are fighting against a bigger force. And I think as people who work in communities and with people, we need to have a stand. What is your stand here? Because people believe credible leaders. They look at your credibility and your position to make an informed choice. Nobody will hate you because you have taken a vaccine. No. But if I say from the time I took the vaccine, I am confident. I built some confidence in myself that I'm not going to get this. And if I get it, the information we have is 1, 2, 3, 4. Then at least people will be convinced somehow. Because we are up against an uphill battle. We are up against an uphill battle. And we don't see it that way, but it's going to be widespread once again. And it has started to be. About 100,000 people are getting infected every day. And about over 1,000 people are dying every day.
Right.
So it is like we are back to square zero. And now the protests against has gone up once again.
Yeah,
it's everywhere.
Yeah,
I think
So it
that's
is
such
like
an
we are
interesting-
back to where we started.
I think that's such an interesting point. And so, you know, I was wondering, does anyone else have any other thoughts about what Pastor Kimatu is referencing? I think it's been a very difficult time to kind of, you know, where many things are being said and we're being challenged on different aspects of COVID vaccines. Any other thoughts, any other experiences? I think one thing I would add is, you know, staying strong on your beliefs and staying strong on what you think and keeping that message going. Because although you are not, you know, you may not be reaching those folks that in masses, right? You may not be reaching those folks in masses, but that one person that you convince or that one person that you tell about the vaccine and how important it is, it makes an impact because that one person will tell another person. And although slow, just that one achievement makes a bigger difference. And I know that's super positive and super ambitious, but I think, you know, taking it one step at a time and keeping strong on what you believe in. I think that's what you were saying. you know, that really does make a true impact. Any others? Any other people have some thoughts about what they're experiencing? Juan?
Just a
Go ahead, Amy.
comment, yeah, sorry, just a comment about the, and I don't remember the exact phrase, but something about when you hear the topic or when we hear things like God is going to take care of me. Part of what I think is that God also gave scientists and doctors and nurses and all of that, all those people, the wisdom and the brains or the whatever to develop the vaccine and to do the education and all that. So I don't think that if somebody says that to me, I would try to expand that, because God has given us the doctors and the nurses and the scientists and the vaccine inventors and workers on and all that kind of thing. And Ruth, I was interested. What? Go ahead.
That's a good thought. My pastor, he say God is not anti-science. He's above science, but he's not anti-science. And it's true what you say. God give wisdom to scientists to help the community. And I know a couple of scientists that they're Christians. This is their ministry to help in this pandemic. So yeah. Thank you for sharing that.
I respond in a very simple way. God has also given you the ability to be careless or careful. So if you choose to be careless, you got it. If you choose to be careful, God has given you that freedom. You still will get, you will get it. If you not get it, rather. So God has given you many abilities. Be careful, be careless. Be watchful, expose yourself, and you can make an informed choice. God is not going to force you into that. You make a choice. So what choice do you make that is beneficial to you as well as the next person? What would God say to you if you are going into a crowd with very many sick people?
Yeah, you have to make a choice. Like,
yeah,
you know, getting a face mask every time, it's a choice, and you do that for love, for self-love and love of other. I saw this week Mimi is the name. It's like a cartoon with some. It's anti-mask in a surgery, and the doctor say, well, you don't believe in the face mask, so I'm gonna do the procedure without a face mask. And the guy was like scary. And it's the same. The mask. I told Kike, I don't know. I told you, Kike. I don't remember. I was in an event from the Assembly of God, and I was in a small group. Talking. One of the pastor a week later get COVID, and I was with him all the time. I get scared. Like, oh, I did a 2 hours line to get the testing, but I get all the time my face mask. I'm a Christian. I thank God that he helped me on that, but I did my part too. I was all the time face mask, my hands clean, instead shaking hands from so, you know, thanks God the result came negative, but I share with him for a couple of hours in a convention.
I saw this thing in Florida that kind of made me think. In one hospital, doctors were holding a demonstration outside the hospital, doctors and the other staff. And they were telling people, we are demonstrating against the anti-vax, those people who are fighting against the vaccine. And they said they are not going to treat anybody who has COVID if they refuse to get vaccinated. So if you get COVID and then we have given you the opportunity to get vaccinated and you refused, don't come to our hospital. They were holding that demonstration. I don't know what the message that they sent out, but there is this now strong way of making people vaccinated because they're just refusing, maybe out of ignorance or out of psychophancy, or it has been politicized. They want the failure of the present, maybe president or something. So there are all those dynamics. How do we counter them? And I think they did some good part. People are lining up, get vaccinated. Because once you get sick, they're not going to tell you. Where do you go? Anyway.
I think this has been such a wonderful discussion. And so I thank you all for participating in this discussion because it was very, insightful to hear about what you all are experiencing, and hopefully we can give you all some tools to be able to combat some of these things. And so I put together a few slides. I don't know, Kika, do you have any slides for true and false? Yeah, okay, go ahead and share your screen. I'll make you co-host. You have about
all right, yeah, I can do it. All right, let's do it real quick. Some myths and facts about COVID-19 vaccine. And here are some information, super simple. Let's start. I'm going to mention the myth and then the fact. It's too soon to know if the vaccine is safe and effective. That's a myth. Here's a fact. All vaccines were roughly tested and studied to meet safety and effectiveness requirements. If I had COVID, I don't need the vaccine. Natural immunity may not protect you against getting the virus again, and vaccines appear to protect people longer. I don't need to wear masks after getting the vaccine. Vaccinated people can still carry and spread the virus to people who haven't or can't get vaccinated yet. The vaccine causes infertility in women. The vaccine does not interact with the woman's reproductive systems or cells, and there are no reports or evidence to support this. The vaccines give you COVID-19. None of the vaccines use any part of the coronavirus that causes COVID-19 and cannot give you the virus. The mRNA technology is new and changes your DNA, or the microchip. The mRNA technology has been used and studied for 20 years. It doesn't interfere with DNA. It cannot change it. So here's very important information. This has been taken from most of the myths out there. So these are the most common myths. So I can share this in the chat if you need it, so you can have it. I'm also going to share a guide for faith-based organizations, so how you can use this in your communities and faith communities. I'm going to put this in the chat right now.
That's awesome.
Yeah, I'm just.
I also have some resources on where you can get a vaccine, just in case you all need that as well.
You're going to email them to us?
Yes, I can email them for sure.
Yeah, so in the chat, I have added the picture that I shared with you, and there a toolkit in English for faith-based organizations.
And then just so for your awareness, there is, the health center is vaccinating their patients. We are vaccinating on Wednesdays from 9 a.m. to 1 p.m. Lowell General is also vaccinating people, and they're doing it out of their immunization center, Chest and Immunization Center. And I'll put the link in the chat for folks who need it to share. You can also find any vaccines on vaccine.gov wherever you are, whether you are in Massachusetts or whether you are in Florida or in El Salvador. You can find, probably not in Salvador, but you can find a vaccine. And then I also want to share some links with you that help you find the right information. I know it's hard to sift through all the information you see out there, but I also want to share where it's appropriate to find. So our health center website has information that is curated and taken from the CDC website. But I also want to share that the CDC also has great information, and also mass.gov. And it's the most current and up-to-date information that you can find. But if you are all set, Juan and Kike, any last minute thoughts?
Hi, Jimali, this is Rani. I think also to include, like, how I think based on CDC or some information related to people who've been hospitalized, that's 95% or 90% of them not vaccinated. So we can have data in addition to that, I think would be helpful for the community.
Perfect. Thank you, Ronnie. I'll include that.
You're welcome.
Some information about those folks who have been hospitalized has been done due to them not being vaccinated, for sure.
I have a question. Ruth, you mentioned some 5 to 6 page document that your pastor presented. Is that possible to share that?
Yeah, I can get it to Jean-Marie to include in the email that will be going out.
That would be great if you could give it to her, then Jean-Marie, you can.
Yeah, so it comes in one list of documents. So yeah, I'll do that.
That'd be great. Thank you.
Sure.
Will you send them
Yes,
like, in links so that we can share them out?
Yes, I'll send them in links. I'll just reply all to our calendar invite, and you'll get it through there, kind of where I was sending the reminders. I'll send it all through there so that you have it in one email. Okay. Any last thoughts from Kike and Juan?
Yeah, keep doing the great job all you are doing. Keep getting informed by a resource that it's reliable, and be careful when you share social media information. And if you have any question about how to get more involved with the faith community, any other tools, you can contact Kike or I. We are the engagement specialists. We work, the majority of our work is with a faith community. And yeah, we are in your disposition.
Thank you, Juan.
Thank you. Thank you, Jean-Marie, for this opportunity. Thank you, Ronnie, as well. It's been great, and I feel honored to be here and knowing you as well. And I want to leave you with this thought. The reason why we're here, it's because people haven't recognized the value of the faith community yet. So having this discussion, we want you to be encouraged that the work that you're doing in the communities, it's very, very, very important. It's key for all this. And not only for COVID, but for many other things, right? To help to improve the community and the life of the people. We are in the business of people, which is the hardest business of all. So I want to share with you these words of encouragement. Keep going. Sometimes can be hard. People do not listen, and we can name a lot of problems, but you're making a transformation in the place where you are. If you have any other questions or concerns, or if you want to be in contact with us, do not hesitate in contact Jean-Marie. Lowell community, they're doing an amazing work with all the vaccines and everything. So we're here to serve you guys, and we're happy to have this opportunity with you. So thank you.
Thank you, Kike, and thank you, everyone. I'm sorry we took 4 minutes of your time, But thank you all for being here. Thank you, Urban Strategies, for taking the time out of your afternoon to be here and support us and this effort. And thank you to all of the faith leaders who are here. And your partnership is very valuable, and we'd love to help you and support you wherever needed, okay? So you all have a wonderful rest of your afternoon. Thank you for being here.
All right,
Thank
bye
you.
bye.
Thank
Bye
you.
bye.
Okay, bye.